Fellow Barbadians, as we acknowledge World Mental Health Day on October 10th, 2025, we reflect on this year's theme, Access to Services, Mental Health in Catastrophes and Emergencies, which resonates deeply with Barbados, a nation that is acutely aware of the psychological toll that emergencies, be they natural disasters, public health crises like the COVID-19 pandemic, or other man-made catastrophes can inflict on our communities and frontline workers. The Caribbean Public Health Agency, CARFA, has highlighted that disasters significantly increase the risk of mental health problems, including acute stress, depression, anxiety, and PTSD, with frontline healthcare workers and marginalized groups being particularly vulnerable. The COVID-19 pandemic alone underscored mental health as one of our greatest public health challenges, bringing unprecedented societal and economic consequences, Barbados having faced numerous natural disasters and outbreaks such as chikungunya, Zika, and Mpox, recognizes the critical need for robust mental health support embedded within our emergency response frameworks. Our government, through the Ministry of Health and Wellness and the National Mental Health Commission, is making substantial strides to bolster mental health services, particularly in preparation for and response to emergencies. We are actively engaged in modernizing our Mental Health Act, ensuring that our legislative framework is inclusive, rights-based, and responsive to the needs of all Barbadians. A cornerstone of this reform is a pivotal shift from hospital-centric to community-based and prevention-oriented mental health care, bringing services closer to our people. Crucially, we are addressing the human resource challenges by strengthening our mental health workforce. This includes continuous training for first responders, such as the Barbados Police Service and the Emergency Ambulance Service, in effectively managing mental health crises within the community. We are also expanding psychological first aid and mental health gap action program, training for healthcare providers and community workers to ensure early intervention and support. The recently unfrozen and updated post of Mental Health Coordinator will also be instrumental in coordinating reform efforts, facilitating training initiatives, and integrating services across various settings. Furthermore, our commitment to the theme of access to services, mental health in catastrophes and emergencies extends to the very infrastructure that delivers care. The recent PAHO Hospital Safety Index and Green Assessment of Polyclinics in Barbados has highlighted the need for strategic smarting interventions. These comprehensive upgrades aim to bolster resilience of our polyclinics, making them structurally sound, functionally efficient, and environmentally sustainable to ensure they remain operational during and after disaster events, which are increasingly relevant given the impacts of climate change. To enhance accessibility, we are exploring telemedicine solutions for mental health care delivery, a strategy I strongly support to expand the reach of our human resources. We are also committed to reducing the pervasive stigma associated with mental health conditions through sustained public education campaigns like the Mind Your Mind community conversations and anti-stigma initiatives such as Check My Bias. On this note, I'm also pleased to share that Lifeline Barbados, our 24-hour mental health hotline, continues to be an important point of access for many of our people each and every day. Furthermore, we are making targeted efforts to ensure vulnerable populations, including children and members of the differently able community, have equitable access to mental health care and communication accommodations where they are required. While significant progress has been made, we acknowledge the persistent challenges, including resource constraints and the need for enhanced data collection for mental health indicators such as suicidal ideation. Accordingly, we are working assiduously to implement a state-of-the-art health information system in the QEH as a means of improving these data collection and analysis efforts by or before the end of 2026. Equally, an overarching policy for interagency collaboration will also be useful in streamlining our efforts. On this World Mental Health Day, let us reaffirm our collective dedication to building a resilient, inclusive, and compassionate society where access to quality mental health services is a fundamental right, not a privilege, especially during times of crisis. It will require a sustained whole-of-government and multi-sectoral approach, reinforced by continued public advocacy and investment. Together, we can ensure that mental health remains a lifeline for all Barbadians.